In the recent decades, the most exciting development is a combination of medical imaging and therapy, namely such as X-ray and ultrasound is not only used in diagnosis but also used in treatment directly. The interventional radiology have a development history of 20 years, but HIFU has the history of only 10 years. Has experienced from US guided to MRI guided, and no one can predict its next progress. HIFU makes wave penetrate and be focused in the body, just like the focus point of the sunlight can generate high temperature. Wave itself is a green means. Ultrasound examination is allowed to pregnant women, but radiography is forbidden. Wave has penetrability and directivity. It can generate a high temperature if the energy density of the focus is big enough. HIFU is the equipment which focuses waves to generate the therapeutic effect. The focus is an elliptical area with a length diameter of 10 millimeters and a diameter of 3 millimeters. The focus arrange in lines, and the lines constitute the planes, and the planes pile up the solids. This is the working principle of the HIFU. We can notice that this is one point, and then treat the next point. Many points constitute the lines. Okay, how we can comprehend that the treating area is a component of many points, just like a digital picture is a component of elements. And how does the focus move? It can move mechanically. The phase array equipment is more advanced. The regulation of phase difference can move the focus and adjust the size of the focus. However, the circuit system is complex. HIFU treats tumors mainly by the heat, which can deactivate the tumor by generating coagulative necrosis. However, HIFU also has an immune effect. It can improve the anti-tumor immune function of the host in various ways. We have many research to support this conclusion. However, no expansion here. It has important significance in the therapy of tumors, especially on the prediction of local effect. Wave is a sort of mechanical wave which vibrates millions of times every second, but HIFU just uses its heat effect. The left chart is a mechanical effect which causes bleeding, and the right chart is a heat effect which is a reason in the tissue coagulation. Our expectation is a result of right chart. Our concern is that if the focus is in the drafted area, if it is completely covered, if it will generate changes of pathological effects, and if it has a clinical significance, namely if it is a benefit to the patients, we should avoid the embarrassment of successful operation but failed therapy. However, the purpose of tumor treatment is not only reduce its size. What is more important is to keep the patients alive. The control and growth retardation of the tumor may have more practical significance than so-called radical cure. There are still some changes of objective index such as the marks and the imaging, and the relief of the symptom is also significant to the patients with advanced tumors. The heat damages the living cells' irreversibility. 50 hours are needed at 45 degrees, but it drops to 0.25 seconds at the temperature of 70 degrees. It is so amazing that only 1/4 second are needed to burn any cell dead at 70 degrees. As we all know, many tumor cells are insensitive to chemical therapy and radiotherapy, but no tumor cell is insensitive to the high temperature of 70 degrees. So HIFU is just like a knife, and the character is like the surgical resection. Into the impulse therapy, the normal tissue around can be kept with full heart dissipation. There are only 10 cell transition layers between the necrosis area and the non-injury area. The sharp edge is just like it is cut by the knife. Let's look back to the development history of HIFU. In 1940s, the assumption was put forward, and in 1950s, it was used in the brain disease experimentally. And the year of 2000 was crucial. China first in the world approved HIFU in the treatment of tumors, and ISTU was held in the next year. In 2002, CE approved that HIFU can be used in the treatment of uterine fibroids who refused childbearing again. In 2004, FDA approved in HIFU in the treatment of uterine fibroids, which is the only non-invasive therapy of tumor authorized by FDA. In 2007, CE approved HIFU to be used in the treatment of uterine fibroids who still have the willing of childbearing again. Now CE certificates that HIFU can be used in the uterine fibroids no matter they want or refuse childbearing. This is a fly used HIFU to treat CNS in 1955. It was the earliest clinical record of HIFU, but it was experimentally, and the equipment were not commercialized. At present, HIFU has two categories. One is the complete extracorporeal HIFU, and the other is intracavity HIFU, mainly through the rectum and vagina. Of course, the application range of the later category is narrower. Some products of HIFU are listed here, not complete. Most of them are extracorporeal HIFU, and the last two are intracavity HIFU. Most of the commercialized machines are made in China, and China is also the country have the most treatment cases of HIFU. In China, HIFU has underwent strict verifications from development to the clinical application. including the security and the validity. Special treatment guide was worked out, but the treatment guide itself can be changed as time goes by and as experience accumulates. This is a clinical guideline promulgated by in China. And now the indications of HIFU have expanded to these tumors. We also find that in the practice it has special advantages to some disease. This is the contraindications, which is relative to the character of the waves and the focus principle. For example, the tumor cannot be too closer to the skin, and it cannot cure the encephalic tumors and the tumors in hormone organs. Wave may be interfered by the air, and it cannot reach the target area completely. Of course, the tumor must be displayed by the inner probe. The indications of HIFU are not very broadly, and it's not Catholic, but I always think that a technique is valuable enough if it has some special advantages in some disease. Most of the articles of on the tumor therapy of HIFU come from China. This research is 104 liver cancers treated by HIFU and judged by grayscale changes and the blood spy with Doppler. The result indicates that 83% of the patients have symptom relieved, and 62% have the decreased AFP. And 1 year survival rate is near 40%. This is angiography of change of blood vessels before and after the treatment of HIFU. We can notice that the blood supply was reduced after HIFU. If HIFU combined with TACE, we can notice that 1, 3, and 5 years survival rate is increased obviously. There are so many positive reports of HIFU on the treatment of renal cancer and breast cancer, such as this and this. There are many research and this. Combine HIFU and neuroadjuvant chemotherapy, then do the mastectomy, and the tumor volume gets smaller obviously without decreasing the security of the radiotherapy. In our patients, there were breast cancer patients that treated by HIFU before the operation, and no active tumor cells was found in the biopsy during the operation. The curative effect is so exciting. I think the pancreatic cancer is the best indication of HIFU owing to the low resection rate of pancreatic cancer. Even the effect of resection was poor, which can highlight the advantages of HIFU. In a random comparing research, the combination of HIFU and chemical therapy has better survival rate and pain relief than the simple chemotherapy. This is the result. This is another clinical study indicates that the combination group has a good curative effect. This is the result of the research. Why HIFU has advantages to treat pancreatic cancer? Because the pancreatic cancer is fixed behind the peritoneum, and in addition, there are some greater vessels around the pancreatic cancer, which are regarded as the forbidden zone of the surgery. But in the treatment of HIFU, the bloodstream will take the heat away to protect the greater vascular wall. And the pancreatic cancer has a low blood supply, which provides easy heat accumulation and faster temperature rising. BPH and prostate cancer also can treated by the extracorporeal HIFU and intracavity HIFU. Maybe the intracavity equipment is more direct and more efficient in heating. It has been broadly used in Europe. I estimate that most HIFU in China are used in the treatment of tumors, such as this. And in this research, the average diameter of the tumors is 5 centimeters. Comparing with the contrast-enhanced ultrasound and MRI, the coincidence rates reach 100%. All tumors reduced at different degrees in 1 year follow-up. This is the ultrasound and MRI after the therapy. The ultrasound shadow indicates that there is no blood supply in the treatment area, and which is similar to the black hole. These are group of tumors with symptoms and the volume of which reduced after treatment of HIFU. Among my patients, some volumes reduced more than 19%. Since the volume is calculated by the diameter, if the diameter reduces a half, and the volume will be the 1/8 of the original, which reduces nearly 19%. However, the tumor doesn't disappear generally, but it may not probed by the BH sound, which is relative to the resolution of the BH sound. We can notice that this is the tumor. This is a tumor before HIFU, and this is a tumor after HIFU. It was smaller, obviously. BH sound and MRI and Doppler after the treatment of HIFU, which is basically accordant. We also can notice that the changes of the treatment of HIFU. These are the common complications, which are all light with low incidence. More and more are authorized gradually, and the clinical application of HIFU has further broken through these bones in China. A large amount of experiments are held in the world. For the treatment of HIFU on tumors, it is prescribed in FDA like that. We will find many spaces for change in the practice. In this treatment for tumors, HIFU may be not the most effectiveness, but it is the secret definitely. With the secret and effectiveness, the comprehensive total score may be the highest. The treatment of HIFU under the guidance of MRI is most advanced at the present. It can not only orient the direction but also precisely measure the practical temperature of the target area. The result is the same as before, with relieved symptoms and reduced tumors. Many clinical experiments prove the same result, such as this uterine fibroid is approved by FDA, and this. There are many experiments. This is the result of the follow-up. Therefore, we can get the initial conclusion of HIFU. HIFU is a new effective and non-invasive treatment way for tumors. The tumor can inactivated by generating coagulation necrosis by high temperature. According to the practical shape of tumor, owing to the application of high technique, the local treatment of HIFU and ablation can become easy and non-invasive. What's more, it can progress repeatedly. The main indication of HIFU is a solid tumor of pelvic and abdominal cavity. In the end, I will briefly introduce you the production corporation and of HIFU, which is the first development enterprise for upper transducer in the world. This is the first upper transducer equipment in the world, and the transducer which elevates the waves is just inside of this. It has 6 transducers, and the 6 transducers have their own focus, which gather to one point. It is called as a double focusing, which can improve the curative effect. The patients lie on the treatment bed, and the wave radiates from here. From here, and it focuses in the tumor lesions. These are the advantages of HIFU 9000. We can notice that there are many advantages, such like conforming to the tumor outline. This is a breast tumor on the bi ultrasound. The tumor count is confirmed firstly, and the computer will scan each pixel automatically. The treatment range covers the whole tumor. If the patients move at this time, the transducer can respond and regulate it. Of course, it is hard for the patients fixed by the water bag to move, which is in favor of treatment. This is MRI-guided HIFU system, still in the development with qualified technicals and beautiful modeling. These are the key difference between US-guided and MRI-guided device. The practical temperature of the targets in the treatment can be precisely reflected, which guarantee effective treatment for every target. Comparing with the US guided HIFU system, we can notice that the MRI guided HIFU have more advantages. It can not only orient the direction but also can measure the temperature in real time. The modern treatment, local treatment of tumors from invasive to minimal invasive and to non-invasive is the development trend, and it has been recognized by the peers. Thanks for your attention. That's all.